Welcome to the Mile High Podcast. This is your host, Dr. Daniel Knowles. Thank you for joining us, and thank you for joining in on Mile High Tick Podcast. You always want to catch Mile High Tick. Make sure you hit subscribe, whatever channel you are listening to this to, whether it be Apple or iTunes, YouTube, Google, Facebook, Stitcher, whatever it might be. Make sure you never miss an episode, and of course, be on higher ground in September 23rd to 25th, Mile High 2020-21. And we are super thrilled that we're focusing on the art this coming year. That whole event is going to be on the art, and which is I'm super thrilled to have as our guest on the podcast, one of the people that will be sharing at Mile High. Dr. Ron Castellucci will be doing a session on the art of chiropractic, and we're going to talk about the art of chiropractic now. His journey began at Logan College. He graduated in 1988. He practiced in Missouri and Massachusetts, but now is ended up in North Carolina active practice, and he is a professor at Sherman College. So I'm always glad to highlight Sherman College as it's my alma mater as well. So Dr. Ron, thank you so much for joining us today.
Oh, thanks for having me. This is great.
We're glad to have you. Let's have people get started by getting to know you a little bit. Okay. Can you share a little bit of how you found yourself into the chiropractic world?
Well, it's an interesting story. I was living on Long Island in New York at the time, and my uncle and I went to New York Chiropractic College, and he wanted to be a chiropractor. He was in the Air Force at the time, and I looked at the view book they used to have, and and we both looked at it. And I simply thought, well, I could do this. This looks interesting, and that's how I kind of got into chiropractic. He stayed in the Air Force, and I went off to chiropractic school. But my first experience was with a chiropractor when I was 12 years old in Ozone Park, New York. And it was a good experience, although it was a short-lived, and I don't remember a lot of it. But I really just looked at chiropractic, and I thought that was interesting to me. I didn't have any miraculous changes that a lot of people have, with chiropractic. So I kind of got into it with the sense that it looked like an interesting profession, and I kind of jived with the philosophy, and I grew from there.
Cool, very cool. And you found your way to Logan from Long Island, so yes. That's an interesting transition. Missouri.
I went to Logan not knowing about Logan technique.
Uh-huh.
And my first experience was in first trimester. During the first week, we literally palpated the sacrotuberous ligament, if you know where that is, on skin. And so my thought was, what is this? I've grown to love Logan Basic technique, and I utilize it with babies and our pregnant mamas. But my initial experience was not what I expected. So it's crazy.
Well, and actually, let's start with that for a moment, because we were talking a little bit before we got set up. In many ways, Logan Basic is a sadly lost art in the profession, or not been lifted up to, no pun intended, lifted up to the level that it should be in terms of its impact on the spine and nerve system, and not people necessarily being aware of it. Can you share anything about you, Logan, or Logan technique, or anything that you are aware about it that would be interesting to people?
Well, Logan technique is it addresses an anterior inferior sacrum, and it's a very common misalignment with infants, going through the birth canal and the squeezing and that type of thing that happens. And so we find it a lot with infants. And Logan Basic technique is actually a structural adjustment, if you think about it. It's one of the original tonal techniques, I believe, simply because we're working with the tone of the sacrotuberous ligament. And that pressure on the sacrotuberous ligament literally changes the position of the sacrum. But the really neat thing about Logan Basic is that it works with what the body wants to do with the sacrum. And so, so one of the other techniques that I work with is advanced muscle palpation. And advanced muscle palpation works with the muscles and the ligaments and to see what the body, the innate intelligence, wants to do with the subluxated segment, in this case, the sacrum. And Logan Basic literally works with that whole mechanism, with that light touch, to change the position of the sacrum. So I've really grown to appreciate Logan Basic technique, and perfect, wonderful technique to work with infants, those newborns. And because we're working with an area of the spine that is parasympathetic in its the neurology, you're actually activating the parasympathetic nervous system when you make a Logan contact. And so working with pregnant mamas, particularly later in their pregnancy, third trimester, or maybe the last month even, that's a good thing to do, is to kind of calm the nervous system down as she's preparing to give birth. So I kind of went into it not really knowing a lot about it, didn't practice, wasn't really crazy about Logan technique at first, but as you dig into it, you see really the benefits, and it's pretty awesome tool to utilize. And I think network that you practice and you teach uses a lot of Logan contacts. So it's kind of seeing that cross connection with other techniques is nice.
Yeah, absolutely. A lot of network is foundation is particular
Mhm.
Logan contacts and variations of them.
It's interesting.
And I read the original Logan
Hmm.
manuscript when I was in school and studied it, and it's very interesting. And I
Oh
highly
yeah.
encourage people to at least get to know about, because you learn a lot about the spine and nerve system
Hmm.
that isn't maybe taught in more segmental models.
Correct.
So
Correct.
and so now you're advanced muscle palpation.
Yes.
A lot of people don't even know what that is.
You know.
Can you talk a little bit about that?
Well, um, uh, it's based in the neurological phenomenon called proprioception. And proprioception simply is joint position sense. So in other words, the body is aware of where the joints of your spine are and where they're supposed to be. And so the whole concept of advanced muscle palpation is that muscles move bones. And so when we have a subluxation, the body's aware of that and will attempt to bring those vertebrae back into their proper orientation, the proper orientation for what that body wants to do. And so we see a segment, we want to adjust the segment, and we use our intelligence and we analyze it, and we apply the force in the direction and make the correction the way we feel is best. The body takes that force and actually positions the vertebrae properly. And we all understand that. The muscles know, the body knows where that vertebrae is and where it should be. And so muscle palpation, or advanced muscle palpation, is actually feeling the subtleties of the increased tone of muscles that are working, if you will, to maintain proper relationship or proper alignment in the spine. And so it's the art of actually feeling the muscles and feeling what the body wants to do with that particular segment. If we knew what the body was attempting to do with that subluxation, our adjustments become more specific, they become more gentle, they become more focused and tailored for that particular patient. And so it's kind of like reading the body, utilizing the muscles to do that. So it's a pretty amazing technique, and it's a technique that really works very well with infants, because a lot of the other analysis we really can't utilize with a 2-day-old infant. Yet proprioception is something that is functional with an infant, and the muscles will respond in an infant spine just like they do with an adult spine.
Yeah, and I gotta say, we learned that from back when I was in school, and Reggie
Mhm.
introduced us to it, and we learned
Yeah.
that in at Sherman.
Hmm.
And it's very fascinating, and it's sad that it's kind of becoming a lost thing also in the profession, because a lot of people, it's not in chiropractic education at most institutions.
That's
There's a
correct.
few.
Yeah.
And it's such a fascinating thing.
Hmm.
I know Nick Spano focused on teaching, carrying that on or pass that torch. And I'm
Hmm.
glad you teach that.
Yeah.
And you're going to be teaching that breakout session on that at Mile High, which will also be super
Yeah.
exciting because it will expose a lot of doctors and students to that. I
Hmm.
think it's fascinating, just this concept that you're looking, the conceptual philosophical aspect of, you're looking to where is the body attempting to do something to apply a force so the body can continue to do or do better what it hasn't been able to do,
Hmm.
as compared to manipulate what you think is out of place, which
Right.
is a very important philosophical difference.
Hmm. I think that, it could apply to any technique at all,
Right.
and it just is going to enhance what you already do. So whatever analysis you use, and it's always good to work along with the body and give the body what it needs, in many aspects of life, whether it's nutrition or, exercise, whatever it might be, that idea of knowing what would be best for the human body, in this case, applying a force to make an adjustment, is just a really good thing. And so I teach that at the college. So the college has that as one of its core analysis procedures. But I also teach it in my ICPA class because I teach an ICPA module, and I also do. I teach it in other seminars as well, and so there's a real interest in it, and a curiosity, and the fact that it could apply to upper cervical. You do upper cervical work, utilizing this and having this as an assist or whatever in part of your analysis, is amazing. And I'm sure that when you work with our network practitioners, they're feeling tones of
Right.
things, whether it's ligaments or muscles or
Mhm.
just feeling the tone of the body, and so that's kind of the same idea as muscle palpation.
Well, utilize it as part of. It's not necessarily taught in network, but I'm aware of it from my
Yeah,
training in it, and I utilize it along with network in terms of
absolutely.
being aware of the muscle,
Mhm.
those working muscles are changing by what I'm doing, or if they're not.
Yeah, that's beautiful.
And as I said, you said upper cervical, and palpation. Let's talk about that a second.
Yeah.
In
Hmm.
many ways, sadly, palpation's a little bit of a lost art.
Yeah, yeah, I think you're right. I think the reliance on X-ray, the reliance on some other technology, is good. I mean, it's okay to have that technology, but the art of being able to just use your hands and be able to feel, it is a bit of a lost art in some of our schools and in some of our practice, our professional circles. I think chiropractors do palpate, but I think it's something that we need to develop a little bit more, being a touching profession and being able to read and pick up things that you just can't pick up with technology.
Yeah,
So I
and
agree with
and
you.
so let me ask you this.
Hmm.
This, we've been talking about the art. Where did
Yes.
you find your way into? Where did you really get excited or enthused about the philosophy of chiropractic?
Reggie Gold. As with many of us, Reggie, I remember when I first started in chiropractic, I learned about the philosophy after I graduated from school. And I really learned, I really understood, Reggie Gold, the whole idea of BJ and that type of thing. It was something that I just resonated with. I was like, wow, that's almost the missing piece. It's not just the mechanics of chiropractic; it's actually a philosophy. And Reggie once said that chiropractic doesn't have a philosophy; it is a philosophy. It's a philosophy with a practical application. When we adjust somebody, understanding the philosophy is going to help with that person's understanding of receiving the adjustment. right? And the experience and all the things that go along with, getting chiropractic adjustments, getting chiropractic care. Understanding that philosophy just elevates that. But I learned it from Reggie Gold and others, going to different seminars and whatnot, and just kind of picking that up. It took me a while, because I didn't grow up with chiropractic philosophy like you did at Sherman. I grew up in a school that the philosophy was taught, but not in the same way as Reggie Gold. So so it was hard to kind of get some of those other thoughts out of my head, wrong ideas, if you will, about philosophy, and so. Yeah, it's amazing how much the philosophy is actually a part of what I do.
Right. And
really
to
is.
refine.
Mhm.
So that area of what you teach at Sherman,
Yes.
you are a professor. Your official position is a clinical sciences professor of clinical
Yeah,
sciences,
I guess
right?
you would say that. Sure.
You've been there for
Yeah.
how long?
Do I have to say? 22 or 23 years, I believe.
Okay.
Yeah.
Yep.
Yeah. Yeah.
And
Something like that.
so wait, so when did you get there?
Actually, I started in 98. So
Okay, so it was
21 to be
after I
20.
left. Okay, I was gonna say, I don't
Yeah.
remember you being there because I left in
No.
96. Okay,
96. Yeah.
we,
Yeah.
we just missed crossing paths.
Yeah.
Rochelle was there though, because she graduated in 99.
She was. Yes. I
Yes,
remember that.
yes. So
Hmm.
so there you go. So now with that, talk a little bit about the experience, the joy of getting to teach students chiropractic and introduce them to that.
Well, there's the whole idea of teaching. Just I met Tom Gilardi back in '95, I think it was. He was visiting the community that I practiced in Boston for 10 years, and so he was visiting the area. Had dinner with him, and I never really thought about teaching until I met Tom, and I thought, well, that'd be a fun thing to do, to teach. And so we went through the process of selling our practice, and we, my wife and I, we moved to North Carolina. So I've been in continual practice since 1988 when I graduated from Sherman College, from Logan, and so we started a practice, and then I started teaching. The excitement is when students get it.
Mhm.
When students get it, when they you could just see that aha moment,
Mhm.
when they're able to feel something or to be able to make an adjustment. Chiropractors, I teach chiropractors all over the world with the ICPA, and I get that same thing where they're, why didn't somebody tell me about this? And that little aha moment where they actually can feel something, and they make that connection. And so that's an exciting part. But the other thing is that when I teach somebody, a little part of me goes along with them when they graduate. And so so I touch their lives, and a little part of me is with them. And when they go and touch thousands of lives in their practice, it just multiplies what I'm doing. And so in a way, it's I teach a student, and that student then goes out and changes lives of thousands of people. And so multiply that over all the students that I've seen, and it gives me a greater impact in the world. And that's what it's all about.
Right.
That's the good stuff. That's the
Impact
good
is
stuff.
one of my favorite words to
Yeah.
focus on, in terms of like, well, I want to have impact as a chiropractor,
Yeah.
and
Yeah.
I want to have impact beyond my four walls of my office. So that's a pretty big impact. Adjusting people is a huge
Absolutely.
impact, right? But
Yeah.
then,
Yeah.
like, well, there's a big world, and
Yeah.
we need a
Yeah.
lot of chiropractors. We need a lot of
Absolutely.
chiropractors that have a clearer philosophical understanding
Hmm.
of what chiropractic is.
Absolutely.
Um, so where was, I know you said Reggie Gold.
Hmm.
And this may be a more challenging question, but I think you can
Okay.
handle it. Where was there a particular point that the philosophical light bulb went off?
Yes. Yes. It was in New Hampshire, Concord, New Hampshire. And so I went to a meeting of the New Hampshire Straight Chiropractic Society. I think that's what they were called at the time. And it was Reggie Gold, and there were two other chiropractors that were there speaking, and it just hit me. I was like, wow, that's amazing. It wasn't like a religious experience necessarily. It was more logical. Reggie really, he talked logically about the philosophy. I mean, we hear a lot of philosophers who chiropractic speakers, and it's almost like a religious, spiritual kind of a. He talked very logically about it, and while I'm a passionate person, that logic really hit me. And so it was probably before we actually no, I think it might have been, just before we moved, the Christmas season. I left practice in St. Louis to move back to the Northeast in Boston, and to practice because I couldn't practice the way I was practicing in St. Louis. It was a good experience. It was fun, but it was definitely not a philosophical experience. And so that Christmas season, I saw that part of we went up to New Hampshire and we saw Reggie Gold. And so that really did it for me. Yeah, wow. It was pretty amazing.
Yeah. And there's a lot of people that have a very similar story.
That.
So, now you teach for the ICPA.
I do.
Right. Tell us what you teach for the ICPA.
Well, my focus, the seminar is advanced pediatric analysis, right? Mm-hmm. And advanced meaning that we utilize muscle palpation. So what I do in my module, I focus on infants and newborns. That age group is oftentimes a difficult age group for chiropractors to deal with, because they can't really just modify their techniques and their analysis for a smaller person. We're dealing with an infant, and so I do muscle palpation, and so I have adapted advanced muscle palpation for adults to work with the babies. I've adapted our motion palpation that we do to adapt that to the infant spine, and then I teach a technique. And the technique is very interesting in that there are a lot of contacts, a lot of touches, a little vibration types of contacts, and they're very specific for the babies. In fact, when I come out to Mile High, that's some of what I'm going to be sharing with the group, giving them some tools, just a couple of things to kind of get them to have that experience, and maybe some tools that they can kind of take with them and easily apply in their practice.
And I'm glad you said that, because let's talk about that a little bit.
Yeah.
And people are aware of that we are focusing on the art, which we've never done. And I cannot tell you how excited I am about this. Yeah. This is going to be a different flavor of program, very much philosophically focused on the art. Yeah. However, all the breakouts are going to be around the art, and all the main stage are going to be different technique presenters as well, which I think will be a very thing, because often when people have discussed technique, sadly, they're in technique and analysis. I'm putting it all under the same thing for conversation. So much is it rock throwing, like my technique's better, or it's ego stuff, and that kind of thing. And we're really focusing this on not that, but rather like, what can someone who's presenting Gonstead teach that would be of value for the non-Gonstead chiropractor to be a better chiropractor?
Absolutely.
Right. So, which is going to be a great, I've never been to anything like that in chiropractic. So I'm very excited about it myself, for my own growth, and to hear all the great speakers. Tell people a little, and so all the breakouts are also doing that. What are you going to be talking about in your breakout session?
Well, I'm gonna introduce the concept of muscle palpation. and how we might do some muscle palpation with a baby. And I'm going to focus on the infant or the newborn, first couple of months of life, and we'll talk about some of the muscles that you might utilize to analyze an infant spine. How they might feel, the whole concept, and a little bit of the science behind it, because I want to get a little bit more of the technique and the hands-on. And then I'm going to show them how we actually make some contacts. In my seminar, I teach adaptations of Gonstead technique, adaptations of diversified technique, adaptations of toggle. And so there's a lot of different adaptations. There are adaptations of all these different techniques. So we'll talk about a couple of the adaptations and see if we can't get the group to kind of play with that a little bit, because I want them to be able to take away not only some analysis, but adjusting. If you think about it, an adjustment without analysis is manipulation. So when you talk about technique and adjustment, it requires the analysis. And so I'm going to kind of combine those two and give them a couple of tools that they can take away and maybe utilize in whatever practice that they have. So
yeah. What you just said was a very important point. And maybe we can talk about that a little bit more in this podcast with that concept.
Okay.
Can you talk a little bit about how I don't think people learn enough analysis in chiropractic school.
I agree.
In certain chiropractic schools, they do, and certain ones they don't learn any, other than based upon the restriction or a symptom-based, protocol.
Right.
So can you talk a little bit about why analysis and philosophically congruent analysis is important?
Well, when we talk about analysis, we're analyzing for subluxation. If somebody doesn't want to utilize that term, analyze for the position of the vertebrae and how you're going to actually address it with an adjustment. But philosophically, subluxation is a neuromusculoskeletal entity. And so whenever we have subluxations or, whether it's a segment or a global subluxation, there's a neurological impact. And so whenever we make an adjustment, we're affecting the neurology and we're allowing that body to actually function at a higher level or function at a level that body needs to function at. But without the analysis, I'm just pushing on bumps and I don't want to call it a manipulation because I don't want to downplay or talk down to somebody who may not utilize as much analysis. We're not saying that you're manipulating, but really it's just blindly pushing here or there without the analysis. And so the analysis is key. When the analysis is absent, it does become more of a manipulative, almost moving bones and hoping that something clicks in a sense. So a big part of my seminar and a big part of my technique is actually analyzing for what I'm actually going to do. The adjustment is very important. We have to be very specific, and it's very much an art that we do. I'm better today than I was yesterday with my adjusting, and so we need to have a good artistic, development of that art. But not to put it down. It's not hard to do. The adjustment part is not the difficult part of chiropractic. The difficult part is knowing what to adjust, and what's even more difficult is knowing when to adjust. And so that falls in the analysis. And so not to simplify technique, because I love watching chiropractors adjust and the beauty of that. But when that's combined with a really good analysis, then you got something really special that you're doing. And so I always say that in my seminars, and I even teach students here at the college that without analysis, you're just manipulating. You need to adjust, and you need to analyze.
And I see, and this is not a particular protocol statement like Gonstead upper cervical network, whatever. I see so much of that when I meet students and young docs that were trained in whatever school they went to, that there's not an analysis protocol other than I heard a noise and something moved. And it's
Right.
really painful to see that.
Hmm.
And so that's why we're focusing on the art, because we don't want it to be a lost art. We want people to really have that uplifted in what
Yeah,
they're doing.
I
So
agree.
that's especially with what's gone on in the world this last year, people need
Oh
better
yeah.
care
Oh,
from us as a
absolutely.
profession as a
Yeah,
whole.
no
Um,
doubt about that.
to
No
help
doubt
them
about
be at
that.
their best. And there's another area, analysis. There's a whole nother art to not just analyzing that person that day. And you
Mm.
know this from practice. I know you know this. But seeing the analysis of the progression of the person's integrity of their spine the first week
Oh
to
yeah.
3 months later to a year later, and to see that, to perceive that change of the person as their healing process is a process rather than an event that happens. There's so much of like, you're just fixing the subluxation that's there that day, and it's
Yeah.
like not a whole hole with that person.
Yeah. Oh, a very important visit in any chiropractor's office should be that follow-up exam,
Yeah,
the follow-up evaluation. Where here's where you were, here's where you are now, and here's where we're going.
right,
And
right.
people love to see that change. And so whatever your protocol is, whatever the analysis that you do, take that and put it together so that patients will see, or practice members will see, here's where you were, here's the things that I found with you,
Right,
and look at the change that we made.
right.
People want to see that. And
Yeah,
it motivates them, it gets them excited that not only are we changing in how I feel, but we have functional changes. So
yep,
in other words, the changes are their body's function, right?
yep.
But you know what, Danny, the good stuff is when they can they can hold their grandkids again.
Yeah.
The good stuff is when they tell you that they're able to do things that they could not do before, either physically or sleep through the night. I had headaches for 20 years. This guy suffered with. Chiropractic. Yes, it's a symptom, but did it change that person's life? And that's the impact that you talked about, right? and
Right,
and that's
right.
the good stuff in practice.
Yeah.
That's why I love doing what I do. I love being in practice and experiencing that.
Yeah,
So,
me
yeah,
too. And I just had this experience. You probably had it where like I working on a person, I'm like, wow, this is like, it's a different spine, or it's like a different person from
absolutely.
the way that person was 6 months, a year ago, whatever. And that's really the
Absolutely.
beauty of seeing that progression in the art. We don't want it to be lost to people see it as an event and fixing a joint.
That's
So
correct.
by any means.
Can I, can I
So
share a
that'd be a
story?
disservice to humanity.
Oh, I agree. Can I share a story? A little
Yeah, yeah, yeah.
boy, a little 6-year-old is had a brain tumor. He was under my care since he was born, and this is something that came up. They discovered it from various means. He went to Duke University Medical Center. Was pretty aggressive. They did surgery on Monday. On Monday, this was months ago. He did surgery on a Monday. He was home on Thursday. I mean,
Mm,
that's amazing. Brain surgery,
wow.
and he was home on Thursday, and the doctors were amazed. And we've heard those stories, and that's a good thing. That's good stuff. That's the good
Yeah.
stuff. That's the impact that we're having on people's lives. But the whole community got together in the homecoming, and it was all excited and whatnot. And as he drove up, we were there because we were part of the family. I've known them for many years and worked with the kids and their family for many years. And so we were there. Hundreds of people were there. And this little guy, his name is Lennon. He drove up and he recognized two people. He recognized Nana, and he told his mom, "Hey, there's Dr. Ron. Picked me out in the crowd." And so he got out of the car and he was getting hugs and whatnot. And I stood back because, the family wanted to have family time with him. And he saw me through the crowd, and he come rushing over and hugs and gives me a big hug. That's the good stuff. I mean, that is, that's that heart, you
Yeah.
know, you get that stuff in practice. You're touching people's lives and having such an impact.
Well, I do a lot of things for chiropractic, and I tell people, my staff, all the time, the best part of anything I do is the moment I walk in the office, I'm only focusing on checking people's spines. Like I do like things, and I love talking to you, Ron. Don't take this
Yeah.
the wrong way,
Yeah.
but of
Yeah.
all
Yeah.
the things that I do for chiropractic, the one that's most is the most fun. It's like the easiest and
Yeah.
joyful is serving people. You know,
Absolutely.
so.
Absolutely.
Thank
Yeah.
you so much for joining us on the podcast. We are
Thank you for
so
having me.
thrilled to have you be sharing at Mile High Live and being there
Yeah.
and doing the breakout. It's going to be such a gift for the people that are there to hear
Thank
you.
you. Thank you.
So thank you for being part of Mile High this year.
Thank you. I'm looking forward to it.
I'm excited to have you there. And hey, if you have not grabbed your seats, people, milehighchiroregistration.com. You've got all the information there. September 23rd. It's the week after Chiropractic's birthday. What else you want to do after Chiropractic's birthday than rise up to Mile High? So we'll see you all there. And remember to hit subscribe. You never want to miss any Mile High tick. Keep changing spines and lives and minds with chiropractic.